the GBD study uses the disability adjusted life year, or the DALY, as its main metric of measurement to measure disease burden or health loss, essentially. And to estimate the DALY for a particular cause or disease or injury, we take both the morbidity or the disability associated with that disease, combined with the mortality, so the years lost to premature mortality associated with that disease as well. The HALE is essentially the opposite of the DALY. So we leverage on what we know about the morbidity and the mortality within a given population to estimate the years spent in good health as opposed to poor health. There's a lot to digest from GBD 2021 in terms of trends in disease burden globally. There's a few things I'd like to highlight here. First off, between 1990 to 2019, we've seen rather encouraging and consistent improvements in disease burden, largely due to reductions in vaccine preventable deaths and also reductions in under 5 mortality rates. What this has meant in 2021 is we've seen a shift in the drivers of disease burden globally, from communicable diseases now to non-communicable diseases coming to the fore. So stroke, ischemic heart disease, COPD, diabetes, for example. So what that means is, although populations are now living longer, they're not necessarily living in good health. And we need to pay attention to those non-communicable diseases as well as continuing gains made to communicable diseases such as HIV/AIDS as we move forward. The second trend I'd like to highlight from GBD 2021 is that it provided us with an opportunity to look at the impacts of the COVID-19 pandemic. So GBD 2021 estimated burden for both 2020 and 2021, and there we saw COVID-19 emerge as a leading cause of disease burden for these years. What we saw for the first time in 30 years in 2020 and 2021 was an increase in age standardized DALY rates at the global level due to the COVID-19 pandemic. We saw, as I said before, COVID-19 emerge as the 4th leading cause of disease burden in 2020 and the leading cause of disease burden in 2021, largely due to deaths from COVID-19 in those years. Over and above that, GBD 2021 also looked at burden from the long-term secondary consequences of COVID-19. So we saw additional burden from long COVID, as well as additional burden from the mental health consequences of the COVID-19 pandemic. So added burden from depressive and anxiety disorders as a result of the pandemic. Different diseases and injuries will come with different trends when it comes to both sex and age. But we were talking about COVID-19 just before. And what was interesting there was that although males and females were impacted largely in the same way when it came to COVID-19 infections, we saw larger burden from COVID in men compared to women. And that was because men were more likely to die from COVID-19 compared to women. However, when it came to the long-term consequences of COVID-19, we saw the opposite effect. So women were more likely to be impacted by long COVID. They were also more likely to be impacted by the mental health consequences of the COVID-19 pandemic compared to men. Overall, we've seen improvements and continue to see increases in HALE between 2010 and 2021, say, and that is in spite of a decrease in HALEs of about 1.4 years during the 2 COVID years, so during 2020 and 2021. These HALE results serve as a new baseline for years to come as we continue to recover from the COVID-19 pandemic, as the socio-demographic circumstances of different countries change, hopefully for the better. As life expectancy improves, we expect to continue to see sort of this increasing trend in HALE. So GBD 2021 serves as an important baseline for that.